topic here. Remember, cystic fibrosis is serious mucus all over the body, which clogs and damages the organs, mainly the lungs, digestive tract, and reproductive organs. So, the four big NCLEX tips to write down. Number one is chronic hypoxemia, that low oxygen, and respiratory infections. This is from damage to the lungs, and the sticky mucus damages the small intestines, leading to number two, a bowel obstruction, also known as meconium ileus, and vitamin deficiencies. So please be sure to write this one down. This is mainly from that thick mucus that blocks the pancreas, preventing the pancreas from releasing the much needed pancreatic enzymes to help break down fats and proteins, and to absorb vitamins. So naturally, we see the lack of nutrient absorption, which leads to number three, weight loss and failure to thrive, especially in our pediatric population here. These guys are trying to grow and develop. So don't let the NCLEX trick you. It's not obesity or weight gain. We're looking at specifically weight loss. And very lastly, the thick mucus also blocks the release of insulin, resulting in number four, diabetes mellitus. So think, without insulin, sugar cannot go into the cell. And so naturally, this blood sugar builds up in the bloodstream. So with our clients, we see hyperglycemia, blood sugars that are elevated. Now, in terms of the causes, children need to inherit one copy of the gene from each parent in order to have the disease. And for diagnosis, a blood sample or a sweat test once the infant is at least 2 weeks old. So ATI mentions, a child who's suspected of having cystic fibrosis. Which of the following diagnostic tests will confirm the diagnosis? Sweat chloride test. And HESI, a child admitted to rule out cystic fibrosis. Which result should be reported to the HCP, the provider basically? A sweat chloride concentration of 80 microequivalents per liter. Now, in terms of complications, as mentioned before, a bowel obstruction called meconium ileus and diabetes mellitus, that high blood sugar, since the pancreas is clogged and insulin cannot get out, putting that sugar into the cell. Now, don't let the NCLEX trick you here. Not diabetes insipidus. That's totally different than diabetes mellitus. So just think of the M in diabetes mellitus as managing the sugar for mellitus. So HESI mentions two questions here. Question one, endocrine disorder commonly found in children with cystic fibrosis, diabetes mellitus. And question two, which is the earliest postnatal manifestation of cystic fibrosis? Meconium ileus. Now, switching gears to nursing care, the big NCLEX tips to write down is that the nurse should teach the parents to feed their child a diet with two key terms here: high calories and high fat, protein, and carbohydrates. Now, this is done to meet the growth and development needs of the child with cystic fibrosis, since these clients will usually have nutritional deficits and weight loss. So please be sure to write this down. Many students get this wrong. Everything should be high in the diet. So don't let the NCLEX trick you here. It's not a gluten-free diet. That's for celiac disease with that wheat allergy, and not cystic fibrosis. So remember, cystic fibrosis, we have serious mucus, and not a sodium restriction. We actually want to increase salt during warmer weather, since children will sweat out that salt. So please be sure to write it down. High calories and high fat, protein, and carbohydrates. Now for other nursing care, let's play a segment from our MedSurg course. So number one is diet. We always encourage high calories due to the impaired digestion and impaired nutrient absorption. And always we give enzymes with meals to help with digestion. So the key term here is with meals, not before and not after, but with. Now, number two is the mucus. So we increase fluid intake to help thin that mucus. We also encourage exercise to help loosen that thick mucus in the lungs and promote lung expansion. We use chest physiotherapy, which again helps loosen mucus, and postural drainage, which also helps to loosen that mucus. Now, Kaplan mentions expected intervention for clients with cystic fibrosis. The key term there was postural drainage as an intervention. So ATI mentions a 9-month-old infant diagnosed with cystic fibrosis. Which of the following strategies should the nurse explain when instructing the parents? Perform chest physiotherapy. Yes, remember, this is always done regardless of the symptoms. It's always best to loosen those thick secretions before they become problematic. And chest physiotherapy is typically done before meals, especially with children, to ensure they eat adequately. And speaking of diet here, Kaplan mentions a child diagnosed with cystic fibrosis. The nurse should intervene when the child takes pancreatic enzymes 1 hour after eating. Yes, the nurse definitely needs to intervene here. Remember, enzymes are taken with meals and snacks, not after and not before. So, question 2, the nurse instructs the parent of a 7-year-old child diagnosed with cystic fibrosis about required dietary modifications. Increase protein and carbohydrates. Yes, everything should be increased. High protein, high carbs, and high fats, and even high calories for that high growth and development. Lastly, we have pharmacology. So let's play that segment now. Now, the most tested drug to focus on was acetylcysteine, brand name Mucomyst. So let's play that segment now from our pharmacology master course. Next is acetylcysteine, brand name Mucomyst. The indication here is it helps loosen and thin mucus secretions for serious mucus like cystic fibrosis. So guys, think serious mucus like cystic fibrosis, we use acetylcysteine. Now, it's the antidote for Tylenol overdose. So we think acetylcysteine blocks acetaminophen. And it's also given before the cath lab to protect the kidneys from that contrast dye. So we always say acetylcysteine protects the kidneys. Big side effect that we have to be cautious with asthmatic patients. Now, the big key point here is it's not safe and can cause worsening bronchospasms. So always clarify any prescription that is given for asthmatic patients. And a big patient education, guys, the rotten egg smell, that's completely normal. All right, that wraps it up.